All right, good afternoon, Dr. Whitman and Dr. Meeks. This is Lee Sonnenberg, and this is my eye podcast. The eye is the primary organ of vision, and the eye has 3 layers, 3 chambers, and 3 fluids, so to say. The eye can be divided into 3 chambers. You have the anterior chamber, which is the space between the cornea and the iris. You have the posterior chamber, which is this triangular area between the iris and the lens and the ciliary bodies. And then you have the vitreous chamber, which is this space behind the lens. Okay, I'll start by discussing the parts of the eye found in the anterior chamber. And y'all actually get a little color coordination for this. So the cornea is this area right here. And the cornea, that colored in real quick, is the outer clear part of the eye, and it's the part of the outer layer of the eye that allows the light to pass through it. The primary function of the cornea is refraction, and it's the strongest refractive part of the eye and provides about 65% of the refractive power of the eye. Okay, the pupil is the next area I'll talk about. The pupil is this round hole in the center of the iris. The pupil allows light to pass through the iris, through the cornea, through the iris, into the retina. Okay. Now, the iris is the colored portion of the eye that you see. You know, some people will have brown or blue or green or hazel irises. The iris is a muscle that's responsible for controlling the diameter and size of the pupil. And so, in essence, the iris is controlling the amount of light that reaches the retina. Now, the anterior chamber of the eye is filled with a watery fluid called aqueous humor. The aqueous humor is produced in the ciliary bodies, and it flows over the lens, through the iris, and into the anterior chamber, where it flows out of the eye through the trabecular network and the Schlemm's canal. The aqueous humor helps provide the eye its shape. So I'm just going to do a little wigglies in yellow for the aqueous humor. Right there. Okay. Now, the canal of Schlemm, or Schlemm's canal, as our kids ophthalmologists always called it, is the structure in the eye that allows the aqueous humor to drain off the eye into the bloodstream. And it is right here. And it is actually at the end of the trabecular meshwork. And I would compare the canal of Schlemm in the eye kind of similar to the drain of a sink. And the canal has to be clear and free of obstructions for the aqueous humor to flow out of the eye and drain. And this opening and clear flowing canal of Schlemm allows the eye pressure to maintain constant in the eye. Okay, and then finally we have the conjunctiva. And the conjunctiva is a thin membrane that covers the inner surface of the eyelid, which I guess you really can't see right here, and the white part of the eyeball, or the sclera. The conjunctiva acts like a seal between the eyelid and the sclera, and that's why you can't really, lose your contact lens down behind your eyeball, because if it falls underneath down into behind your eyelid, it gets stuck on the conjunctiva, and then you can dig it out that way. Okay, now let's move into the posterior chamber of the eye. Now, within the posterior chamber of the eye, we have the main structure, which is the lens, and a nice little blue color for you. Now, the lens is a transparent structure in the eye that focuses light on the retina. The lens is located behind the iris, and the lens does not have a blood supply, and so it receives all its nourishment from the aqueous humor. The lens is made up of 3 layers, and you have the capsule, which is the outside, the cortex, which is this area about right in here, and then you have the nucleus. The lens, I would say, kind of looks like a peanut M&M, is how I would think about it. The hard candy shell is the capsule. The cortex is the chocolate, and the nucleus is the peanut. And that comes into effect when you're dealing with cataracts, which I'll explain here in a little bit. And the lens is responsible for the remaining refractive power of the eye. Now, the lens is suspended from the ciliary body by suspensory ligaments. And we don't have them shown here, but I'll kind of draw them in real quick. Kind of look like that, but they go all the way around the lens. Now, these are long, thin fibers that connect the lens to the ciliary body, much like the springs on a trampoline connect the frame to the bed. Now, the ciliary body produces the aqueous humor. And we'll color that in right there and right here. And in actuality, it's not just two separate pieces, but it goes all the way around the eye. The suspensory ligaments, in conjunction with the ciliary body, help the lens to focus light on the retina by changing the shape of the lens, being thicker or thinner. And this is called accommodation. And young children can do this quite easily, but as you age, the lens begins to harden up a bit. And so accommodation is not quite so easy as you age. Okay, now we'll move on to the vitreous chamber, which is the third chamber of the eye. Now, the vitreous chamber is filled with a gelatinous substance called vitreous humor, and it fills up all this area back here behind the lens. I won't color all that in, it'll take me forever. The vitreous humor helps the eye keep its shape, and it composes 2/3 of the volume and 2/3 of the weight of the eye. Now, in childhood, it is a gel that slowly begins to liquefy as folks age. The vitreous humor is clear, and thus it allows the light to pass through the lens to the retina. Now, we'll move to, not technically part of the vitreous chamber, but it's just kind of the next section of the eye. The sclera is the outermost portion of the eye, and it is what we would call or consider, the whites of your eye when you're looking at it. It is everything that surrounds the outside of the eyeball that helps it maintain its shape and protect it, except for the cornea. The sclera is also where the interocular muscles attach to the eyeball, allowing the eye to move in the different directions. Okay. Now, the choroid is a second layer of the eye, and it is the layer between the retina and the sclera, and it is this black line here on this map, or this image. The choroid contains the blood vessels that carry blood for the eye, and the choroid is responsible for providing oxygen to the outer layers of the retina right here. Now, the retina is the light-sensitive inner layer of the eye, and we're going to color that one pink. And again, the retina covers the entire inside of the eye, not just kind of this back section that you see here. The retina is like the film in a camera. It's what processes the light images. The retina is transparent, allowing light to reach the photoreceptors that process what we see. I guess what you can say, they process what we see in simple words. There are two types of photoreceptors, rods and cones. Cones are responsible for our detailed daylight vision and color perception. I always remember that cones and colors both start with C, so that's how I can remember which of the photoreceptors is responsible for color. The rods are more numerous than cones, and rods are responsible for our peripheral and motion vision, as well as nighttime vision. The macula is a circular area right here in the back of the eye on the retina, where the light is primarily focused when it comes through the lens. The macula is the area of best vision or central vision in the eye. Now, within the macula, you have the fovea centralis, which is responsible for our most acute vision. Now, only cones are found in this area of the retina, in the macula and the fovea centralis. Now, each rod and cone is connected to the brain by a ganglion nerve fiber. It's kind of a simplified version. And all these nerve fibers, when combined, are considered to be the optic nerve. The optic nerve transmits the electronic impulses from the eye to the brain. Now, the optic disc, or the blind spot, is the location in the retina where all of the ganglion nerve fibers collect to form the optic nerve. There are no rods or cones in this area, so you have no visual stimuli being processed here. And finally, we have the ora serrata, which is a serrated junction between the retina and the ciliary body. Now, the 3 eye diseases that I am going to talk about, 2 are common in my family that we have dealt with over the years. All 3 of my kids have congenital glaucoma. And glaucoma is a condition that causes damage to the optic nerve and is associated with an increased pressure inside the eye. And the increase in pressure is caused from the inability of the aqueous humor, which is produced in ciliary bodies, and inability of it to drain from the eye. And now, in the case of my kids, their Schlemm's canal was not formed completely in utero. And so the aqueous humor was not able to drain off as quickly as it was produced. And so each of the kids have had to have surgery to kind of reopen that drainage canal. And how I kind of compare that to, or explained it to the kids, is that you can envision the canal of Schlemm as kind of the drain in your kitchen sink. And when it is clogged up, the water eventually overflows, out of the sink into your kitchen floor. In the eye, when it's clogged up, what happens is the pressure increases in your eye, and it begins to cause damage right back here where the optic disc is. And so their physicians, their ophthalmologists talk about their cupping ratio. And what happens is as the pressure increases, it slowly crushes individual ganglion nerves, and when that nerve is crushed, then whatever light it was picking up here is no longer being transmitted to the brain. So you slowly begin to lose your peripheral vision with glaucoma. And a lot of patients don't realize they even have a problem until it's too late. Students with glaucoma will need optical aids, magnification. Scout suffers from photophobia, and so she needs to have sunglasses and a cap, sometimes inside the building. Her visual performance can fluctuate, and children with glaucoma can benefit from O&M as they deal with transitioning into new, unfamiliar areas when they're having to deal with the photophobia and loss of vision. Now, Scout has also had a cataract, and a cataract's an opaque or cloudy area located on the lens. And there are several causes of cataract formation: congenital, when they have them from birth, induced through trauma to the eye, which is what Scout's were just due to the number of surgical procedures she's had to have, induced through medications, and then induced by age, which is really the most common form of cataract. Cataracts can be described as looking through a dirty window. Cataracts can be surgically removed. The nucleus and cortex of the lens are broken up and destroyed and then kind of vacuumed out through a little incision in the, through the capsule. Had to look at my notes, sorry. And then a prosthetic lens is reinserted into the capsule. Now, students with cataracts will need accommodations within the classroom. Lighting that reduces glares, or lights with adjustable arms where they can focus the light where they need it. Magnification. Students who've not had a cataract removed may have eccentric viewing, so if they have an unusual tilt of the head, teachers should be comfortable with that because the child's really trying to look around the cataract. And then the third disease I want to talk about is aniridia, which is a congenital defect of the iris. The iris is either partially developed or completely absent, and as a result, the eye is unable to regulate the amount of light that enters the eye, causing photophobia. Patients with aniridia are at a risk of developing glaucoma since the iris did not form correctly, and that all is formed out of the ciliary body. So you will have some genetic defects that either cause problems with the production of aqueous humor or the drainage of aqueous humor. Glare and lighting conditions need to be controlled through the use of special lenses and or control of illumination, and magnification will help, and teachers should not stand in front of a window or a light source when teaching. And sunglasses and a hat may be needed in bright sunlight. All right, thank you. Y'all have a good day.